also talk about going back to the healthcare service, the CAS report yesterday, the big review, a 4-year review by a leading paediatrician, former president of the Royal College of Paediatrics and Child Health, Hilary Cass, into what is going on with treatment of children who believe they are trans. There's such thing as a trans child, remember? The Health Secretary, Victoria Atkins, has demanded that NHS clinics report on the long-term outcomes for the 9,000 young people who were treated as trans patients at the Tavistock Clinic. It's extraordinary, the report, actually, the number of clinics that were treating children, and this was only looking at children, just simply refusing to comply, refusing to give any information. And certainly there have been no long-term studies into what happens later on. Do they suffer from further mental health problems? We know, the suicide rate, people wanting to detransition, people's problems with infertility, damage, with bone cancer is one of the outcomes of starting puberty blockers so young, brain development, all of these things. And it's extraordinary these experimental drugs were given without knowledge of what the long-term outcomes were, and it would appear total lack of care from the Tavistock staff about what those long-term impacts could be. It is absolutely vital that these clinics come clean with all the information they have, and if they don't have it, seek it out.
Yeah, 100%. And those medical professionals that ignored the Hippocratic Oath, which within that oath, it turns around and says, any treatment is not automatically drugs or surgery. They seem to go drugs or surgery. They were experimenting on children. That's child abuse in my mind.
But again, I've said it all along, when you have a kid and they say, oh, half a paracetamol maximum. Oh, but here are some puberty blockers. Yeah. It is absolutely extraordinary this allowed to happen. I also find extraordinary the number of people who were happy to call people like me transphobes, the J.K. Rowling and Helen Joyce and Maya Forstater and Kate Barker and Graham Linehan, who we're going to talk to in about 20 minutes' time. So many people who were speaking out on these sort of issues. James Dreyfus, people who lost what... I'm very lucky, You can call me a transphobe as much as you want. I don't care. I know I'm not. But I do care about children in particular being safe from political ideologies. But the Stonewalls, the Mermaids, pushing for all of this, the Labour Party, massively supportive of all of this.
Not today. You've U-turned.
Yeah, but not today. Well, let's have a watch and a listen of a clip of Wes Streeting. I've got a lot of time for Wes Streeting, Shadow Health Secretary. He's been very sound on a lot of this stuff, actually, given his party. But when you saw people like Labour MP Rosie Duffield, just the abuse that she had, no support, and basically, the Labour Party basically, Keir Starmer saying nonsense things like trans women are women and 99.9% of women don't have a penis, but 0.1%. Just nonsense stuff. This is an interview that Wes Streeting did with Harry Cole, who's editor of The Sun, on The Sun's Never Mind at the Ballots broadcast. Let's have a watch and a listen of this conversation.
They ran a campaign saying trans women are women, get over it. Do you agree with that?
No, to the extent that, and I say this with some self-criticism and reflection, if you'd asked me a few years ago on this topic, I would have said, trans men are men, trans women are women, some people are trans, get over it, let's move on, this is all blown out of proportion. And now I sort of sit and reflect and think, actually, there are lots of complexities and challenges.
Isn't that the problem, that leading figures like yourself, and I'm not just singling you out, but leading figures like yourself were saying, get over it,
no,
when people were trying to raise the facts. So you regret,
I absolutely take the criticism on the chin.
It's actually really nice to hear a politician say, yeah, I think I was wrong. But I'm fascinated, BBC, Sky, all these people have been, organisations, been pushing this ideology and telling people like me and many, many, many others who've done far more to speak out on this issue, that we're all transphobes and bigots. All changed your tune today, have you?
Well, yeah, and that's the trouble. People latch onto something, and that seems to take a momentum all of its own until then there's proper research and it's looked at and found wrong, and people then change their minds. It's really good to see a politician changing his mind.
That is, always give credit, and actually he's been pretty sound on a lot of this stuff as they go. But it genuinely, for me, it's just, the idea that politicians just go with what they think is what's the perceived dinner party approved conversation.
What'll get me tomorrow's vote?
Yeah, exactly. Yeah. Well, it was just, what happened to actually thinking about it yourself and morality and honesty, and I just find it absolutely extraordinary. And I'm still quite cross about this thing, the toxicity of the debate that Hilary Cass talked about, clearly talking about how people couldn't speak out. There's only been one side that's been toxic, the side I've been on, the side people, we've just been trying to stand up for women's rights and for children's safety. That's not a toxic debate. I've not been calling anyone names.
The minority trying to impose reviews on the majority and the majority scared to talk out about it. That, in other ways, is defined as terrorism.
Yeah, people losing their jobs or being, basically sort of non-personed because they speak out about abuse of children. You live in a crazy, messed up world if that is what's going on. Anyway, we talked about that an awful lot yesterday, and that's what's been going on in our beloved, wonderful, praise be NHS. It was that lot doing it. By the way, until some of these people are actually, if they didn't actually, actually comply with the CAS report and demand for information, they should be sacked on the spot. Bye-bye, out of a job and frankly prosecuted. But in terms of wider healthcare, I want to ask you today about NHS hospital waiting lists. They have fallen for a fifth month in a row. 7.54 million treatments still being waited for by 6.5 million patients now left waiting for that treatment. I want to know, are you confident that your family can get the healthcare they need? Tell us your experience, whether good, whether bad. Give us a call, 0344 499 1000, text on 87222, or get in touch on X @TalkTV. Fiona has done just that and says, I've given up trying to be treated. I think most people aren't bothering anymore. Yeah, people who aren't bothering are the people who then end up dying of cancer, by the way, because they don't get treatment in a timely fashion. Go to the doctor. Mark says, I can honestly say that I've never felt like I've had bad treatment from the NHS. I've had to wait a week or two for a doctor's appointment for non-urgent things. If you need to see someone because you're properly ill, then you can usually get to see someone within 3 days. It's the idea that in this country, in a first world country, 6th richest country in the world, you think that waiting 2 weeks for a hospital appointment or when you're seriously ill, 3 days for a doctor's appointment is acceptable. Wow. I mean, wow. That is terrifying to me. And Darren says, are they accounting for the deceased in these drop-in numbers? So basically, as we don't know, I mean, that's the thing. With A&E, 250 people, there's the Royal College of Emergency Care saying they think that 250 people are dying every week because of long waits in A&E. They're just not being treated in time. Absolutely extraordinary. Do get in touch on the phones. Let's go to Gloria, who's done just that, who's in London. Hello, Gloria.
Hello, Julia, my sister from another mister.
I love that. What do you want to say? What's been your experience, and do you trust the NHS to provide care for you and your family?
Well, I can't say I do in this instance. I reported a lesion on my left arm that had changed color a couple of times, alarm bells.
Yeah.
My GP reluctantly had a special photograph done, sent it to the dermatologist, texts me back to say you have Bowen's disease, but it's not cancer. And I thought, fantastic.
Okay, yeah.
But I checked, and sure as you know what, Bowen's disease is cancer.
Is a form of cancer.
So
it was just a casual text. I mean, you got a response quickly, I suppose, but yeah.
And he then said, it's a routine appointment. You can have, and I got an appointment for August 15th. This was a couple of months ago.
Wow.
Now, because I'm a loudmouth American, I don't take stuff like this lying down. I did my research with the wonderful help of Macmillan Cancer, did my research with NICE, which said that my lesion had all the earmarks of somebody who should be seen straight away.
Yeah.
Still wouldn't budge, had to get my MP involved. And then finally, I now have an appointment next week.
Well, thank goodness for that. But this is the thing, unless you're sharp-elbowed, unless you're, let's face it, Gloria, like you and me, just like willing to go, nope, not taking no for an answer, then I'm afraid you get treated later. And that's why people in this country die of cancer more than they die of cancer in most of Europe. Simple as that.
And my sister, who lives in America and is on Medicaid, which is treatment for the low wage,
yeah.
she gets an appointment straight away and gets to see a consultant within a week.
Yeah, I mean, that's the thing. People, again, the message we just had from someone saying like, oh, it is pretty good. I can see someone within 3 days if it's urgent. I mean, we have just got this completely skewed, and people are under the illusion that this is the norm. It is not the norm in most Western countries. I really appreciate your call, Gloria. Look forward to seeing you at Family Christmas as well. I hope the appointment next week goes well.